Good morning, everyone. I'm Nathan Shapora, political advisor at the European People's Party, and on behalf of the EPP, welcome to another episode of EPP Family Talks. Over these past several weeks, we've had the privilege of speaking with leaders throughout our political family about the ideas and projects they've been working on during this time of coronavirus crisis. This morning, it is our great pleasure to welcome with us Stella Kyriakides, former president of the Parliamentary Assembly of the Council of Europe, vice president of her party and now EPP member party, the Democratic Rally of Cyprus, and now the European Commissioner for Health and Food Safety. Commissioner, thank you so much for joining us this morning.
Thank you. Thank you.
We've been asking all of our EPP leaders as we start this series just how they're doing, personally speaking. So my first question to you before we get into your portfolio is just how have these past few weeks been like for you as far as a routine? What have typical days been like for you?
Well, I've been in Brussels since the beginning of the lockdown, and before I've been here all the time. A normal day would be in the morning, starting with a call with the President von der Leyen on a daily basis and all the commissioners involved in the COVID-19 pandemic for coordination and discussion of the issues of the day, and then endless video calls with different stakeholders and colleagues and ministers. Time to prepare something very quick to eat. And what I would say, I also remember, and what I'm still doing, is 8 o'clock joining everyone else and clapping for the carers at my window.
Well, I want to follow up on some of the specifics in your portfolio, but first another question which we've been asking all of our leaders just about the situation in their home countries. You're, of course, from Cyprus, which is being led by our EPP friend, President Anastasiadis. So just could you update us what's happening on the ground in Cyprus before we then come back to the very important pieces of your own portfolio?
Well, I'm very pleased that to say that in Cyprus, the country that I know best, they are now starting to open up in small steps. They took measures very early, strict measures very early. The curves have flattened and they have steadied the number of new cases, which is very low. They're trying to now open up slowly. As you know, Cyprus, their main source of income is tourism, which is crucial for them to be able to get this going again. But they're doing this very, very carefully and always having public health as a priority. So they're monitoring the situation very closely, but they are doing extremely well.
Well, we're very glad to hear that. And I know several of our EPP friends, our EPP governments have been doing an exceptional job. And
exceptional.
In your own portfolio, you're really, as you mentioned, you're talking every morning with the President of the Commission. You're really on the front lines. Health and food safety really, it can't get more sort of critically important than this as far as this pandemic. Could you just give us tell the story, narrate for us what the main challenges were to start this at the start of this crisis, and what have been the most important steps that you've taken so far?
The main challenges at the start of the crisis, or the crisis for us and for myself and with the Commission, we started looking at what was happening from the 9th of January. So it was on the 9th of January that I mobilized the early warning system and the ECDC to start looking at the situation. So for us, it started very, very early, immediately entering the new year. The greatest challenge at the very beginning was the getting over the belief that, first of all, this would not affect us in the European Union, and secondly, the belief that member states could tackle the crisis on their own. I, from the moment, was advocating, saying that this is a crisis that we needed to work together, we needed to be coordinated, and that nobody would be able to deal with it alone. And I was calling for this from the end of January, when I asked member states to have their pandemic plans prepared, and also I was supporting the Italian minister to call an EPSCO Health Council. So that was the first challenge. The next challenges were on a very practical level. And for myself as a health commissioner, I have never seen the numbers that everybody else reads in the morning just as numbers. I was seeing them every day as individuals, as stories. as hundreds of people losing their lives in our member states every day. And on a practical level, the greatest challenge was trying to support member states in their health systems in order to be able to give the best care possible. And this is why we coordinated with joint procurements for personal protective equipment, with issuing of guidelines on how they would be able to take containment measures, testing strategies, guidelines, and facilitating cross-border help. So to see the solidarity in action of patients from Italy being treated in Germany, Norway, sending doctors and nurses to the northern part of Italy, and not only. There were a lot of work went in to see this type of support for member states who were really hit very hard by the pandemic in the early stages. I would also say that we had to deal with other issues which may not be so obvious to someone dealing with the crisis from an outside. For example, we faced an issue with huge delays at the borders of going across, of trucks moving across the borders within the EU. This meant that we couldn't get medicines and the food supply where it was meant to go. And the Commission immediately stepped in to establish the green lanes, which would mean that no trucks would spend more than 15 minutes crossing over to another member state. So what we were actually doing on a daily level was assessing the situation and problem solving. And that has been the greatest challenge. Working with industry and pharmaceutical industry, weekly course for the last almost 3 months with Commissioner Breton, to make sure that we weren't only addressing shortages of medicines, but proactively looking at where there could be shortages of ICU medicines. So it has been a huge effort by a very large team within the Commission under President von der Leyen to tackle what is an unprecedented public health crisis globally. You could never predict what would be the issues that would come up really almost in the next day. But what you could do was the moment problems came up, the Commission would step in and try to be as effective as possible in solving them.
Thank you so much for that update and for your work and decisive action in these past few weeks. I wanted to follow up on what you said about solidarity. No member state can do this on their own. In specifically with regards to medicines, I know you've been working very closely with health ministers from around the European Union. Just a few days ago, I think you were on a call with health ministers along with one of our other commissioners, Maria Gabriel, who's working on innovation and research. And I just wanted to ask specifically on medicines, things, finding a vaccine, also therapeutics rather. What's the state of play on these issues?
I've been working very closely with health ministers, weekly calls for the last 2 months, having them on board at every step of the way with all our guidelines, discussing what we were issuing with them so that they would be on board, because as you know, health is a member state competence. So what we can do, though, is when we're recommending and having guidelines together with ECDC, making sure that these are shared with member states so that they can be implemented. Each member state would move at their own speed according to where they're pandemic. And I would say that not only weekly calls, health ministers know that they can call me 24/7 on my mobile for the past 3 months, and I have called them many times. So one of the issues that we have been dealing with is the issue of vaccines and therapeutics. What we need to realize, what all European citizens need to realize, that as long as we don't have a vaccine, this virus will always be among us. And this is why I always stress, and I take this opportunity, that we need to be vigilant and now that we're lifting containment measures, never stop remembering the importance of hygiene and social distancing, because the virus is there. It has not gone away. We have worked very closely with Maria Gabriel, with my colleague, to support research for vaccines and therapeutics, mobilized over 380 million for this. And on the 4th of May, President von der Leyen chaired the Global Pledging Conference event, which is ongoing, and raised 7.5 billion to support diagnostics, therapeutics, and the vaccine. The responsibility being not only to find the vaccine, but once it is found, to make sure that we produce it in large enough quantities, and then we can reach countries which may not be able to afford it, because the European Union looks not only at its own family, but looks at also those who are unable to access, who will be unable to access a vaccine, so as not to leave anyone behind. So for myself, it was a very moving afternoon, I must say, to see so many countries around the world, globally, come together to reach this common goal.
I want to pick up on that idea of not leaving anyone behind, and also pick up on something you said earlier about green lanes, ensuring the supply of essential goods. And that has to do with the other piece of your portfolio, which is food safety. You said a few days ago in a speech, and I'll just quote here, food poverty was a concern for millions before this pandemic. Now it is a reality for many more. Business as usual is no longer possible. And you've been promoting an EU farm to fork strategy to help ensure food security for every person in Europe. Could you just explain what exactly this strategy is and why it's so important?
You see, my perception, the way I see health is a holistic way. And for myself, what we say about public health and protection and prevention is intimately linked with food safety and food security. And the Farm to Fork strategy, which will be presented on Wednesday, has the goal of maintaining the high quality and standards of food safety and sustainability that the EU already has for food, to reduce the risk of pesticides and the use of fertilizers, to tackle the problem of antimicrobial resistance, to reduce the environmental impact of the food chain and retail by taking action on issues such as food waste and storage. And also, I would add two more issues. First of all, better communication for the consumers. They have a right to know what they're eating, and we will be looking at this very carefully in Farm to Fork. And adding the very important issue of animal welfare, because we need to look at health in this way, that it's inclusive. And for myself, it's not a different part of my portfolio. They're very closely interlinked. So when I'm speaking about non-communicable diseases like cancer, I cannot ignore the importance of nutrition. So for me, it's a parcel, and I'm very happy to be able to be presenting Farm to Fork on Wednesday.
Well, I mentioned that you're really on the front lines of this: public health measures, medicines, therapeutics, food, nutrition. All of these aspects are really critical to the overall health of citizens. And another aspect, which I know you've been very focused on and which maybe has fallen a little bit under the radar compared to these other urgent issues, is the area of mental health. Of course, you yourself, before your career as a politician, had a career as a clinical psychologist. So I wonder, could you just give us your thoughts about the state of mental health now in Europe? What are the challenges, and maybe what is your best advice, the best practices which we should be keeping in mind to keep ourselves healthy?
Mental health has always been a challenge, because mental health really is an area where those who really have the issues and the problems and the difficulties, the most vulnerable among us, are those who often don't have a voice. So for myself, it has always been an issue, the need to speak out about mental health, to highlight mental health. We cannot have health in a human being without having both parts there. Mental health and physical health go together. And in COVID-19, this has really put a lot of people under huge stresses. The fact of the lockdown, the fact that we usually tell people, for example, who are depressed, that you must not isolate yourselves. You must seek to have social contacts. And we are now in a position when we were telling people, stay away from people, stay locked in. So there were many challenges for children, for children in high-risk situations, for cases of domestic abuse. And this has been highlighted. From what we have also seen, this has given rise to solidarity. This has given rise to a number of movements across the world, with hotlines and support lines coming up, because mental health issue has now been recognized as one of the issues that COVID-19 has highlighted. So it's something that we need to focus on. I will definitely be focusing on it in the rest of my mandate, because COVID-19 has highlighted some of the issues that are already part of my mandate: the need for a new pharmaceutical strategy, Europe beating cancer plan, it has given them a different sense of dimension, but it has not put them in the second line. They're still very front line. And one of those for myself has always been mental health, and I'm following very closely what the impact of COVID-19 has been on it, and the recent work coming out in terms of research now on the impact.
I hope that we can finish the interview with a couple of more fun, more personal, more informal questions. I have one more serious question, though, for you before we get to that. And that is, I know you've been a very active part of some of our EPP ministerial formations with foreign ministers, with general affairs ministers. So I have a two-part question, which is, how do you see the EPP family showing leadership during this crisis? And then maybe more broadly, what are some of the concrete next steps you foresee for the European Union? Actually, I could dovetail that with, we just had a question from a viewer, Juliana, who asked about concrete next steps as well. And in particular, I think she's asking about possible preparations for a second wave maybe coming in. You know, who knows if a second wave of the coronavirus were to come in the fall, let's say.
Well, thank you, Juliana, for that. I don't like speaking about a second wave in terms of predicting that it will happen. We are very aware of it. We're very vigilant. This is why I send the message to citizens all the time that this virus is there until we find the vaccines. We must stay vigilant and take all the measures that member states, governments are asking them to, and not let our guard down. And in that sense, I believe that if we are able, and this is what member states are doing, and I have advised them to do, to monitor the situation. So if with the lifting of containment measures, we have new cases, they're able to pick them up as quickly as possible and isolate. We will have new cases. We will have an increase in new cases, lifting containment measures. The whole point is to be able to hold the situation as stable as possible and to be able to contact trace and contain as effectively as possible. And hopefully in this way, we will not have a second wave. In terms of the EPP family, it has been an invaluable support to me throughout, and I need to thank them for that. I have joined my political family in many ministerial calls and also spoken with President Weber several times. And they have really helped and supported me throughout. And I believe that the EPP has shown leadership throughout this crisis in many of the positions it has taken. And they fully support the positions that I have been discussing, that we need more Europe in the area of health. This has become obvious with this pandemic. And we're already in very close contact with my colleagues and MEPs in the European Parliament to be able to discuss the many topics that have come up from the pandemic. So we haven't finished this journey. We're still going along on this journey. There's a long way to go. And of course, very close coordination within the EPP is crucial in terms of working closely together with the Parliament to see what we have learned from this and what changes need to be made.
Well, again, we appreciate so much your perspective and all the work you're doing on this, and look forward to working with you in these months to come. In the couple of minutes we have left, I wanted to ask you a couple of more fun questions, hopefully, which can help our viewers, our political family, get to know you a little bit better. One of the questions we've been asking lots of our EPP leaders is there a historical figure who has been particularly helpful or inspirational to you as you have gone through these past several weeks of crisis?
I probably would have answered that question a little bit differently before the crisis. I would have tried to think of a historical figure that and there are many that were inspiring for me. But now, for myself, the most inspiring people are the real people of everyday COVID-19, the doctors, the nurses, everyone working not only in the health systems, but who've been in the front line in this crisis. That's why I'm at my window clapping at 8 o'clock every night, even now, because this has shown the solidarity, this has shown the European spirit that we believe in. For myself, these are the kind of heroes of the moment, and the everyday stories that I see coming up because of COVID-19. So I don't really need to go into the past. I would have answered differently a few months ago, but now every time I I see stories of doctors and nurses in our member states who in such difficult circumstances were there day in, day out, night in, night out. For myself, those are the people that I'm kind of looking up to, and I find inspirational and moving.
Well, one final question for you, and that is, especially since your portfolio includes food, I know you've said you don't have much time to eat, unfortunately, but is there in these past few weeks in your very quick mealtime, in the very quick meals you've had available, is there something, a snack, a meal that you've particularly grown fond of, maybe something new?
A snack, a meal. It's going to sound. I am someone by nature that I love to eat lots of fruit. So that would be my snack. I make sure I do try and find time to eat because I think it's important. It's definitely important. But what I try and do in the evenings when I finish. On some evenings, at least near the weekend, and I kind of signals the weekend because when you're home working, you lose a little bit the sense of going to the office and being at home. So when Saturday comes and it's a little bit less on calls all day, I'll have a glass of white wine and indulge myself in some dark chocolate. So those have been my treats for the last 3 months. On some weekends. Other than that, I'm someone who really follows routine quite closely. I find my relaxation, I find my happiness comes out from very simple things in this crisis, from waking up in the morning and the sun is shining in Brussels, from having a piece of good news in one of our member states. And then on a Saturday, I'll just unwind a little bit in the evening, and indulge myself in a glass of white wine and some dark chocolate.
That sounds pretty wonderful, especially hopefully someday soon, maybe we could even be enjoying it, on a beach or at a mountain in a different country, somewhere in the
Yes. So, I different country will be going home to see my family, hopefully in the near future, when I'm able to leave work. But what I would say that as everyone else, what I miss most is the ability to meet up with friends, with you face to face and not over a screen. And to be able, teleworking is great, but we are social beings. And I look forward to that day. But I understand that for the moment we need to be extremely careful because it's with the sacrifice of so many citizens that we have got this pandemic under control, but the virus is there and we need to be vigilant to make sure that we don't have a resurgence of cases. So we're all going to be very responsible and patient, and the day will come, I'm sure we will meet face to face and be able to share that glass of wine and some dark chocolate.
Well, those personal examples and those clear explanations, concrete examples, those are all so helpful. So Commissioner Stella Kyriakides, European Commissioner for Health and Food Safety, we appreciate so much your time. It's been a pleasure speaking with you, and on behalf of the EPP, thank you so much for the work that you're doing.
Thank you so much for the opportunity. Thank you.
To all of our viewers, thank you for joining us again for this episode of EPP Family Talks. Please join us again next time. We'll be speaking tomorrow at 1 p.m. with member of the Bundestag, German Bundestag, and treasurer of the European People's Party, Mr. Christian Schmidt. Have a great day and see you tomorrow.